One more for quorum, and my understanding is that there is some traffic issues, so as soon as somebody walks in, we'll go. UNMC, are you all here for the presentation? Okay. Air quality is here. Okay, let's go. Let's go. You know what? Okay, let's roll. Good morning. We will start the April meeting of the Douglas County Board of Health. For the record, there's a copy of the Open Meetings Act on the North Wall of the Legislative Chambers. And we'll begin with the roll call.
Wade.
Here.
Festerson.
Here.
McNally.
Here.
Rogers.
Here.
Weiss.
Item 2 is approval of the minutes of the February meeting.
We weren't done yet.
Oh, sorry. Go ahead.
Jones.
Here.
Wilkin. King. Espinoza. Okay.
We'll go to item 2, which is approval of the minutes. Is there a motion to approve the minutes? There's a motion by McNally. Is there a second? Second by Wade. Roll call.
Okay. Who seconded? I'm sorry. Okay. Okay. Wade.
Yes.
Rogers.
Yes.
King. Jones. Weiss. Espinoza. McNally.
Yes.
Festerson.
Yes.
Okay.
Approval of the agenda. We have ratifying A, B, C, D, E, and F, and then approving G, H, and I, J, K, L, M, N, O, P. Is there a motion to ratify and approve the items for action? There's a motion by Weiss. Is there a second?
Second.
Second by Festerson. Any questions? Hearing none. Roll call.
Festerson.
Yes.
McNally.
Yes.
Rogers.
Yes.
Jones. Espinoza. Weiss. Wade.
Yes.
Okay.
We will skip the employee presentation until Dr. Hughes gets here, but we will go to item B, which is the UNMC Community Benefit Report. And we want to set that up. Thank you.
Never get to go so early. The traffic was a little interesting this morning. It took me over an hour to get downtown, so I get it. Oops. Thanks for getting this set up.
Oh, yeah, no problem. Okay, we need to share.
Turned into a parking lot real fast.
There you go.
Thanks so much. Thanks so much for having me this morning. Right in my face. Becky Jackson, I'm manager of community health and community benefit at Nebraska Medicine. So it's represented, and we talk about UNMC. We'll talk about that piece here as well. Nebraska Medicine really encompasses the clinical operations and the side of our agreement there. UNMC is our research and academic and education partner. As we represent a lot of different properties and spaces around town, including Nebraska Medical Center, the largest hospital in the state, more than 10,000 employees, and more than 1,400 providers across our system. Here today to talk about our community health, our community benefits, some of our other community engagement work. We're at a little bit of an interesting junction, so I just want to acknowledge that right off the bat. All of the healthcare systems follow a different timeline and when they do their community health needs assessment and their community health implementation plan, all based on really when we started and our tax time frame. So I acknowledge that we at Nebraska Medicine are right at the end of ours. So we'll be taking our next assessment to the board later this month and then have our implementation plan moving forward in the fall. So we are still in our 2022 to 2025 cycle, so just want to acknowledge that, but that things are really wrapping up for this cycle. So I've talked a little bit about these in previous years. I'm just going to give some highlights of where we are. We really took an approach this past cycle that will continue into our new cycle here, of focusing on some methodology on how we selected our priority health needs based on a stronger focus on those priority needs from the community, those that represented differences or where we saw significant differences across the Omaha metro, so where we saw gaps in care, gaps in access, gaps in services. Supported by other external data, we come together with our adult healthcare systems to do the community health needs assessment, but that there's other data sources we have access to, really in alignment with our health equity goals and our population health goals as a system. and that ability to try and impact change within a short-term cycle. 3 years goes pretty quickly, especially in the life of a healthcare system. These are the 4 that we landed on for 2022 as we wrap up here in 2025, based on that needs assessment that we've partnered with, and as we're moving forward into this next cycle. Don't anticipate a lot of significant change to this group, but there will be a little bit of change, which we'll talk about next time. I want to just highlight some of the partnerships. I think we have been successful in the spaces where we have collaborated. And so the partnerships that we've identified in each of these areas has really helped us to see growth. One of the ones that I want to really call out in the diabetes space is our partnership with the health department and offering the diabetes prevention program. We have 2 cohorts of that we are working in collaboration with them on currently. There is one at our Community Wellness Collaborative that is in Karen and Burmese. It's a very engaged group that started earlier this year. We've got a lot of community members that are very interested in that. And really just that program, a CDC evidence-based program that focuses on healthy eating, physical activity, really monitoring those risk factors before somebody would develop type 2 diabetes. There's also a second cohort that just started in South Omaha at Juan Diego that we're also partnering with them on, and we're excited to see the progress and the tracking that we're doing for those individuals. Lots of other programs that have happened over the past 3 years in terms of focusing on healthier food options. We've done a lot in the food space. It also connects to our nutrition goals, and so I'll talk about those over a couple of different components, but everything from supporting our colleagues internally with programs that different coverage of access for those with pre-diabetes or type 2 diabetes to support them. We've incorporated an IART and an AI system for diabetic retinopathy testing in many clinics across our campus to look for those opportunities of expanded care as well. We move into the mental health space. This has continued to be one of our top goals, really since we've started this process. It has been the top goal, as raised by the community repeatedly as well. Our focus is increasing access and increasing the number of practitioners. We know that that's a big gap within our community, and we know that that happens within partnership. So lots of different activities that are happening across the space, and that our team is helping to provide care with partnerships at Charles Drew and Douglas County Youth Center, that we are seeing an increase in access to how we support psychiatry care in our primary care settings. So increasing access to embed that within other care settings that for those components that could be treated in an appropriate manner can be addressed in that way. Community collaboration is really the focus in some of the components around the campaigns and around the community. We have other access pieces in place internally, such as universal suicide screening across hospital admissions, primary care, looking at things that really kind of collaborate within our goals in terms of for our labor and delivery patients, so those parents that are in the NICU and post-delivery and the labor and delivery care, getting those screenings and safety plans in place. And then one of the programs that continues to be really successful from a community standpoint is our Behavioral Health Connection program, which supports anyone, not a Nebraska Medicine patient-specific program, open to all community members, but connecting adults with psychological or substance use disorders to area resources such as transportation, food, et cetera, those components that they need to help getting them into those access points to make sure that they're able to maintain their well-being. Talked about nutrition briefly. We've done a lot with our inpatient screening process across our campuses for SDOH needs, and that all of our adult inpatient admissions are getting screened for these components as it relates to those needs, and then how we can follow up with those, whether that's a short-term need in terms of prior to discharge, or if it's a longer-term need, they're getting facilitated to the right team to support that. We've seen a lot of different access points, and I think this is going to be an interesting space as we continue to navigate through funding issues, but supported fresh food markets. We've supported the partnership with Double Up Food Bucks and things within the community over the past few years, increasing access to the fresh local produce across Omaha for families and for anyone that's utilizing nutrition assistance. Partnerships with community gardens and other food-based organizations across the community. We have some physical activity programs that are kicking off in terms of one that I think one of the first groups here in Omaha to bring a program called Walk with the Doc to the Omaha market. So it's really a provider-based experience where the provider is out with a group of either patients or community members, and then having that bit of physical activity, and then there's also some space for some health education. So there's just kind of a light health topic that's brought into that, and increasing some access to those components too. Across our campus, we really engage in National Nutrition Month, which is March. We've done an annual campus-wide food drive and things to help support the community. So really everything from kind of small P to larger P programs as well. One of our largest programs that we've done is a partnership with No More Empty Pots. And so we're really, really excited about that partnership and grateful for their partnership. But they were able to make referrals from our patients directly to that program so that they can access a fresh CSA box or prepared meals that would meet their dietary needs. So that within that program, they get that direct referral to get support to that service for at least 3 months. Their cadence of scheduling is typically kind of 3 months on, 3 months off, but following that direct access. The great thing about that is it's pretty low requirement from the individual. No More Empty Pots delivers to the families, and so be able to support those households and those individuals and access to fresh food has been fantastic and really well received. We're still right at the 1-year mark of that program, so we're starting the research. We're working on the research to see kind of those outcomes and follow-ups from the patients. Besides the qualitative feedback that we've received, has been very positive. And then just a couple of highlights from our prenatal space. We have really focused on ensuring that our teams are culturally competent and have had trauma-informed care to make sure that they are prepared really for caring for all individuals that come through our services. We've hosted community baby showers. We've done several different community prenatal events. We partner with Ivy Black Girl on doula training. We've done a lot of different work embedding doula support within our system to make sure that they are part of the care team and really supported as part of the care team. Partnering with statewide organizations such as NPIC on birth equity initiatives, which really looks at our data review as a system, enhanced patient feedback, pulling in that doula policy and postpartum education. And then a partnership that we have with Nebraska Diaper Bank, which while birthing individuals are in delivering, they're provided access to diapers on site. So they leave the hospital with additional diapers, and then they also connected to their program for future resources as needed. And I think really just trying to increase access, our focus around our healthcare system and then across our clinics and across the community in expansion to community breastfeeding classes and other needs that support both baby and parents. And I got excited about this one and talked about it early. All right, so I mentioned our collaboration with No More Empty Pots, really a piece that we've done. It expanded, that did start, I'll just add a couple more details, that did start within our primary care clinic settings. We've expanded that to other areas and our other priority areas. So connection to prenatal health, for example, our mental health clinics as well, our diabetes clinic, and other components. And we had over 260 households served in the first year with this program. So just a couple of highlights there. Very exciting program. Apparently wanted to bring it up a couple of times. We mentioned, I think, the opening last time of our Community Wellness Collaborative. We opened in September of 23, and this is a real community hub designed to support the needs of our community. Located at 2120 North 29th Street and across from the Highlander and a lot of our partners there, including No More Empty Pots. We've hosted classroom and gathering spaces for a multitude of community-wide events. You see some of our 4 pillars that are outlined here on the slide. But really that connection to education and the programming. All of our community health areas have planned activities and have done activities across this past year to support community wellness. Our behavioral health connection team that I mentioned previously, offices out of this space once a week so that they're accessible to the community. We have a community health navigator that's housed in this space. We've provided additional components around the doula training and other community programs that are happening here. We're really focusing on workforce as well, and so developing workforce specifically for those medical areas that we know have a greater need. Things like certified nursing assistants, medical assistants, surge techs, and radiology techs as well. And so recruitment for this is very targeted to the community around the Community Wellness Collaborative, so that's 68111 zip code in the Highlander community. We've had several cohorts of students that have been going through these programs to support that. And I did mention the community health navigator. We have, it's kind of our title for a community health worker. We have a navigator that's built in that space that is not Nebraska medicine specific. So actually the majority of our referrals for that individual come from the community. Anybody can walk in, receive support for any of the SDOH needs, but also receives referrals from a variety of our partners. We have a little bit of capacity within that colleague and that team to support longer term needs. So we are finding that we're getting a few more referrals for that, even from other systems that have more of a kind of a short-term strategy. So that's been helpful for those individuals. And so really the connection then to those SDOH resources and other referrals, so applying for assistance, applying for housing, working through the different components that that individual might need. And usually you come in with an acute need or something that's the most immediate need, and then uncover that there's other needs to support that individual. And we've seen over 80 plus referrals since that time frame started. And really an expansion opportunity for our team to continue those resources. Just want to mention a couple of things that we've seen really successful in the past year in regards to our community health screenings, making sure that screening components are incorporated into all of our community engagement activities. But we started in last fall, we started a series called the One Stop Cancer Shop, which is a bit of a tongue twister, but One Stop Cancer Shop events. We hosted one in North Omaha and one in South Omaha, which really provides education and resources to individuals, but also allows them to get screenings within that component. So, for example, at one of the events, there was 27 mammograms, 18 prostate cancer screenings, 10 lung cancer screenings, and 31 colorectal cancer screenings. So just in one component. So by bringing that to the community, it's trying to change our approach of how we get the screenings and the testings and the access to care to the community, instead of ensuring that they have to come to us or to other healthcare systems for that. So trying to increase access within our strategy. Really, access to care and supporting the SDOH resources has been a component of all access strategies that we're doing for our community. Something that I don't think I've mentioned before, so just wanted to highlight, I think we were the first healthcare system to start what we call kind of volunteer paid time off. I know some of our other partners have started that now as well. But it's really a volunteering benefit that we offer to our colleagues. So again, over 10,000 colleagues, we know that we have an engaged resource at our hands within our workforce. And so that allows 8 hours for a full-time colleague or 4 hours for a part-time colleague annually to go volunteer at a 501c3 organization of their choice. We do not dictate what that organization is. We allow that to be space for the colleague to engage how they want. Although we are doing a bit of a challenge this month with some of our partners at Children's Nebraska. So we have seen a lot of engagement this month as well with individuals volunteering at many different organizations. So I wanted to highlight that from some of our community work, and then as always, a bit of a highlight on our community benefit numbers. So I'm gonna share just kind of the total here, as well as some highlights on the next slide. We have changed our community benefit report from how it looked previously to more of that community impact summary. So the most recent one is linked here on my slides. But some of the highlights from the totals, our largest groups are what you see here listed here in terms of uncompensated care, which includes financial assistance for those that qualify for charitable medical care, financial assistance policy work that happens, and then unreimbursed Medicare is the majority of that number. So about 63 million of that is unreimbursed Medicaid. From the uncompensated care category, moving into that middle category, broader community health is typically where we pull in our health professions education, which is a large bucket of that, our research, our community health improvement and benefit operations, subsidized health services, and then our cash and in-kind contributions, which is the largest bucket of that. Again, as have referenced before, some of that is in alignment with our supportive academic programs and operations at the University of Nebraska Medical Center. And then our community building activities, which is always an area I think that we're striving to increase year over year, but those that are really addressing some of those root cause situations of the health problems that our community is facing. So things like workforce development and training, which we've had some very purposeful growth on as well, and work that's happening in that space maybe just doesn't translate as much in terms of the dollar amounts that we're seeing here. I think that's my last slide. I'm happy to answer any questions.
I'm just curious, when you, the slide where when your goal was to, under the mental health piece, I'm just curious, what are you all doing to increase the practitioners? Because that's always heard. I'm wondering what efforts you all are doing to increase the mental health practitioners.
Absolutely. So it's engaging with the education system, right? It's engaging within the healthcare the colleges to increase that. But it's also looking at additional support, so how we can use licensed mental health practitioners in different capacities. It's how I mentioned we have what we call a psychiatry consultation program within our primary care clinics, so that our primary care clinics can access the providers in a different way than necessarily making that referral into the system. We know that there's wait times to get in for appointments in terms of providers. So it's looking at those partnerships also within the community where we can address and support access for those providers in different ways too.
I think you mentioned it might be, how does the pipeline, how does the pipeline concept?
So I think it's increasing both access in terms of growth within the colleges that we have impact to, right? And so collaborating, we partner a lot with UNMC, obviously, Clarkson College and others to address some of those mental health practitioner and provider spaces. But it's also then encouraging the growth of providers that represent a diverse community as well. Mm-hmm. So we know that a lot of times within that behavioral health space, community members are looking for a provider that's representative or that they relate to in different ways, and so trying to engage that growth and the pipeline to speak, representing more of a diverse community too. So engagement across all of those spaces.
So under your nutrition element, is the partnership with No More Empty Pots what you mean when you're saying you're increasing awareness of food, the impact of food insecurity?
It is one piece of that. So it's direct access, and sorry, my allergies are kicking in. It's one direct piece of that work. So that's for patients to get referred directly to that. So when a conversation happens, even in a provider appointment, within those spaces, if something is screened or even comes up in conversation, that provider can refer them into that program. That's one space of it. I think our other work is really around partnerships with groups like City Sprouts and other work that we do with No More Empty Pots and other food-based organizations from that community awareness perspective, and then some of the other resources that we provide. So access within the farmers markets and doubling the access that individuals could receive there.
So when you make that referral, are they on your dime when they go there, or is Medicaid picking that up when you refer?
They're on our dime, but we are not advertising that.
Okay. So what's is the agriculture box a new term for like summer lunch programs? Agriculture
No,
box
it's more of like the fresh fruit and vegetable boxes that you can receive. So it's really what's in season. You see a lot of different salads and salad mixes, vegetables. Kind of depends on the season. So they have the option of doing that. They also get information on how to prepare those items if they haven't seen that before, or they can do the prepared meals, which also would meet any dietary needs they have.
Okay. So my last question. So explain to me, again, I'm just curious, what's included in, you kind of mentioned, I clearly know what uncompensated care does. What's in each of those boxes of broader community health and community building activities? I kind of heard you on that, but I didn't get it.
Yeah,
clear.
so I don't know if I have the opportunity to navigate to the internet here, Heather. I could just pull it up. Would that work? I could just pull our report up. I don't know if that works. Link is live. Doesn't look like it is. Let's go ahead. We'll just go. Oh. Doesn't want me to. Is it? Screen. Okay, thank you. We'll do this So that's the breakdown from the uncompensated care piece. That's the first bucket.
Okay.
And then the rest of the buckets, this is the broader health at the top and then community building. Not too big.
Okay. Okay, I know where to get it then. Okay, I got it. All right, appreciate it.
Any other questions?
Thank you.
Thank you.
All right. With that, we will move to item C, and air quality and sanitation department report. I'm gonna come back. Oh, you wanna do it now? Okay,
Yeah,
we can.
okay.
While they're setting up, if you wanna go ahead.
Good morning. I have the pleasure of recognizing one of our staff this morning, Miss Michaela Ruma, who has been with us for 20 years. So we would love to recognize her for her awesome dedication and commitment to public health. And Michaela is one of these amazing administrative assistants who can handle whatever you're throwing at her. She gets shared between a couple of different programs between WIC and health promotion, so they keep her pretty darn busy. And she's just a fantastic person to have on board. Always has a smile, always is super positive when working with the public or with any of her coworkers. So Michaela, thank you so much for all you do. We are very proud of you and just very lucky that we get to have you on our team. Cassandra, do you have anything you want to add or say?
Just second everything you said. She's wonderful. She's always willing to take on any challenge whenever there's something we need or not sure how to do.
Yes.
She's always willing to figure it out for us and take care of whatever we ask.
Wonderful. All right.
She was also a WIC clerk for a really long time too, so she came in with a lot of knowledge already from our program, which has been super awesome.
That, yes, for sure. Awesome. Well, congratulations. You get to keep pictures. Yes, thank you.
All right. Okay, we ready, Russ?
Hey, good morning, board. Thanks for
Morning.
braving the traffic to get down here to hear this great presentation.
Notice we have some air quality issues today.
Thanks for braving the air quality conditions outside today as well. What are we at? 133. Awesome. So I'd like to present today on what I feel is the best program at the Douglas County Health Department currently. I'm Russ Hayden, supervisor for the air quality program, also the sanitation program, and the sanitary engineering program at Douglas County Health Department. So it's quite broad. I have a lot of different programs in there, but I also have great people working for me. So it makes my job relatively easier. Like right now, the air quality program is probably sitting there monitoring what's happening outside today and basically how long this smoke will remain in the air. So I'll start off with the air quality department. I'm just going to give you a brief preview of like each thing that we do in the departments, kind of a breakdown of what happened in 2024, maybe even somewhat go back to 2023 to 2024 and kind of do a comparable between air quality in those 2 years. So our air quality department, we do ambient air quality monitoring, which is basically monitoring of the outside air environment. We also do some indoor air quality testing for people, not really testing, but we'll do some odors and some indoor air conditioning to kind of check to see how that environment is. We also do mold. Basically, we don't do testing, we do visual observations for mold. There is no mold standard in the city of Omaha or the state of Nebraska or the United States, which if that's something you would like to work on to create some kind of mold standard, it'd be entirely helpful for our air quality department to get more things fixed and solved for people in the public of Douglas County. We also do pollen counts, which is probably happening right now. We do that daily, and it shows up on our website, and I'll show that in a little bit. Our ambient air quality monitoring, we check for ozone, particulates, which particulates are very tiny particles, smaller than like a human hair that you breathe in. Carbon monoxide, sulfur dioxide, nitric oxides. We also have a weather station. And we do chemical speciation, which basically is a small filter that the particles fall on. We measure PM 2.5, send it into a lab, and they break it down from everything from gold to lead to whatever fell on that particle. So it's extremely interesting to see what's actually in the entirety of the Omaha air. Our locations, we have a monitor out in Bellevue, PM 2.5 monitors in Blair, Ralston, also an in-core site, which is at 31st and Woolworth. We have a monitor downtown at PM 10, and that's on the Creighton campus. We're in central Omaha, which is along Dodge Street. It monitors, of course, CO because of the traffic that's there. We're also in northeast Omaha, which is around 16th and Whitmore, kind of close to OPPD. There we have an ozone and an SO2 monitor. Being a power plant, you know, originally they used a lot of coal. They're down to one coal-fired power plant now. So basically the production from that is SO2, so that's why we monitor there. We also have an in-core site, which is one of maybe 75 to 80 in the United States, and that does multiple pollutants. We have a bunch of monitors there for almost every air quality pollutant that we can measure for. And I'd like to say just recently the census came out, and we are at 1,010,010 people for the Omaha MSA. That changes our air quality program to where we have to add more monitors. We have to add another, what's called a near road monitor. Basically that'll measure NO. We also have to have an ozone in there and another PM 2.5. And that'll fall along the busiest roadway, basically, is what we'll monitor there. So we'll have to build a whole new structure and everything there. And we also have to do what's called PAMS monitoring, which is like a GC type spec monitoring for air quality pollutants, and that'll take place at our in-core site. So we'll have to add on additional space to our in-core site. So super exciting for our program that we reached 1 million people. This is our website. You can find all of our air quality data now in real time. All of our monitors switch from like filter-based to real-time monitoring data. You can see the ozone, the particulate matter, nitric oxides, sulfur dioxide, carbon monoxide, all that stuff per hour. We have data and software that all that information gets pulled and bring in and gets graphed out on our website. So you can see it real time. And this isn't live. I just pulled a snapshot off of this one. Also on our webpage, you can see our forecast for air quality and the current conditions. And of course, this isn't the current conditions. It's a snapshot. Right now, it'd be a little higher than moderate. But yeah, you can see how it is today, what our forecast is for tomorrow. I do a forecast every morning on how I feel today's air quality is going to be, and then basically tomorrow's. And if you want to get the air quality forecast, you can also sign up for enviroflash.info, and that'll be emailed to you every day in your inbox if you'd like to actually see what the weather conditions are going to be, air quality conditions are going to be for that day. Why do we monitor and collect data? Well, as you can see outside right now, you know, that's the reason we look at it. This is 2023 and the Canadian fires that affected our area for almost all summer. I mean, they just kept rolling in, rolling in. You can see by the map, these are at the bottom map, those are all air quality monitors across the United States. You can see our region, like right in here. Smoke plumes on the EPA map, basically I have to track and see, how those smoke plumes are coming in. Will it affect us? How long will it affect us? Will a front push it through? And it's for the public interest, to know that today we put out actually an alert, kind of an alert with the state and the Weather Service last night about the air quality today. That way people with asthma and respiratory conditions and stuff like that would know, today could be a bad day. And that's why we monitor, for public health. Right. Yeah, the more population you have, the more monitors you have to have. So like Lincoln, they just passed 350,000 people. So that means they have to have 2 ozone monitors. The EPA, with less than that, they'd have to have 1. So we'll be up to required to have 3 ozone monitors and 4 or 5 particulate monitors. We've worked with the National Weather Service, which has been extremely helpful getting the word out on any kind of air quality conditions that are going on currently. With the help of the state and Douglas County, they'll contact the Weather Service. We'll push out an alert. I don't know if any of you have an Amazon Alexa or anything like that that's sitting next to your table. It's flashing yellow. Basically, that came around from working with the Weather Service. They have the way to put out the alert, which also goes to almost all those communication devices, and then you see it. So I think that was a huge step up, for our program. Instead of us just pushing out press releases or whatever, we can cover the whole county basically with that kind of information. What are you seeing today? Luckily, I had the slide in. This is a prescribed burn, in Kansas. Basically, the frame below is prairie grass, and what's happening basically across the whole Midwest is we're losing our prairie. Cedar trees are moving in and taking over the area, and if you don't have prescribed burns to push, to go through our natural burns, those cedar trees will take over and they'll just be forested by cedar trees. So around this time of the year, usually April, May, early May, they'll burn the entire prairie down there to get rid of the cedar trees and the seeds and stuff like that, to keep a natural prairie that they can feed cattle and stuff like that on. And then on an occasion, that smoke will come up to us when the wind patterns are right. And today, we had a slight inversion and it settled down. And that's what we're having today. It's not Canadian fires, it's Kansas fires. Sometimes we'll also have wildfire or other prescribed burns in the area. We have a UNO prairie out on, what is that, State Street. Sometimes they'll burn, it's a smaller prairie, but they'll burn that, and it'll cause a local effect for those people living around, that prairie. But it's something, if you want to keep a natural prairie, you have to have the burns. The state of Nebraska 200 years ago would always have, burns and from lightning and whatever else, and that would keep a prairie type environment. But we don't do that as much anymore. I'd like to do a little comparison between 2023 and 2024. So if you look at 2023 for ozone, that's when we had all the fires and Canadian fires and all that stuff that was coming through all summer. It pushed like our ozone average above the standard, which is 70, but EPA bases it on a 3-year average. So we weren't above the standard, but it pushes our number closer to being out of max attainment. Then this year, or 2024, was a very good year for air quality. So that, we're lucky that we had some rain in Canada and stuff like that. So our numbers were better, which then lowered our 3-year average. And then if we look at PM 2.5, we have quite a few PM 2.5 monitors. The smoke pushed our weighted average, up almost 2 micrograms per filter and per hour. So 2024, basically we dropped by 2 micrograms. So when stuff like that happens, it does balance out, but if we had 2 or 3 bad years like that, we would be close to NAAQS, basically non-attainment. And that would mean, we'd have to come up with many plans to remediate a lot of the air quality issues that were going on in the area. And it would affect businesses and stuff like that would move into our area. Our air quality department does pollen as well. We have a couple people in the lab that look under a microscope and are able to differentiate the different pollen spores. This is also on our website. So every day at about 9 o'clock, you can see, how the pollen is from the day before. This one here, trees are very high. You'll have trees in the spring, weeds in the summer, grasses usually, later. We do mold, and like I said, there is no standard for mold. We get a lot of mold calls. We had 290 mold calls in 2024. We went out on 26 mold inspections. Basically, we tried to educate, show them how to work with their landlord, send in a 30-day letter to their landlord, certain things like that we also, if we visually see it, we send a letter to the landlord asking them, recommending them to clean that up. And we work with city codes as well. Usually if you have mold, you have some kind of moisture problem or a water leak. So city codes can go in there and force the landlord to at least take care of the water leak. I'm also under sanitation, sanitary engineering department, and the list that they do is immense. We have 4 people in the department, and they have a lot to cover. We do pest management, trash, litter, garbage. We inspect swimming pools, permit residential swimming pools, septic systems. We do mosquito surveillance, which is coming up in about a month. We also permit domestic animals, deal with some hoarding issues, dog waste, which is their favorite, and demolition permits. And we also do a few other things like medical trucks and stuff like that. Our pest management is basically a nuisance type complaint. We do bed bugs, which is in the left corner. If you see one of those, that's a bed bug. The middle one, I doubt I'll have time, but it's a video of how small a gap a mouse can fit through. It's a pretty exciting video. Some bat problems. Cockroaches is on the far right. And then also trash type issues in Douglas County. Remember, we have 4 people. We had 524 nuisance inspections and complaints. 95 rat rodent inspections and complaints in 2024. So that's just based on nuisances. We do swimming pools. Residential pools, we permit, basically we go and look to see if they have a barrier, self-closing gate, no gap in the fence so kids can't climb the fence, that they have a fence, an alarm on their door or a pool cover. So when the pool's built, we get the permit, or we get their application in, kind of look it over, make sure everything's okay, go back out and do a final permit when they have everything in and send that permit. We also inspect commercial pools, looking for chlorine levels, pH levels, cyanuric acid, the main drain, telephone functioning, lifeguards, all that kind of stuff. We look before they open the pool, and throughout the year, at least 2 or 3 times, we go back to commercial pools in the area. The inspectors looked at 411 commercial outdoor pools in 2024 and 286 inspections on the indoor pools. We also, it seems like Omaha wants a lot of swimming pools in the residential areas. I'm not exactly sure what happened after COVID, but the numbers of residential pools have basically skyrocketed. So we did 364 residential pool inspections last year. We do septic systems and wells, map the septic systems. In the past, everything was hand-drawn. With the help of GIS here in the city, everything is done within 10 centimeter mapping, basically, with GIS, and that's all available to the public. So if they needed to see exactly where their laterals and septic tank and all that stuff was, they can go back out and basically find it, because our mapping system is really accurate. They did 110 septic permits, and that's not stopping. You know, the city or people are expanding out in the county, and there isn't, you know, they have to use septic tanks, and it seems like there's getting to be more and more people living out in the rural areas, and they're building big complexes and stuff there. So it's just something we'll have to deal with, is the increase in septics. There were 78 septic installations, and we also look at some wells. We had 50 well inspections. Mosquito surveillance is starting soon. We basically take traps out to 6 locations, collect mosquitoes, send them down to the state. The state identifies each species of mosquito in the trap. I'm guessing that's really exciting. And then they send out the Culex mosquitoes to test for West Nile virus. And then we get a report back, basically, that, you know, we found West Nile. And the state also had some extra money to measure some different viruses. And we actually found 2 positive Jamestown Canyon viruses at Cunningham Lake last year. So we haven't tested for it before, so I don't know if it probably was here, but they had some extra funding, so they were able to test for some extra viruses. We also did 2 tick drags to find different species of ticks that are in our area and how they're moving in based on the climate. We do larviciding, basically to reduce mosquito activity. And everything's on GIS, so we can see when we larvicided, when we have to be back, the efficiency of it. It's all mapped. We do domestic animal permits and inspections. To your left is why we do it, which is the chickens. That person did not have a permit, and there was probably close to 40 to 50 chickens that they had at their residence. And people don't want to really live next to that, right? We have to basically have it permitted properly to where their coop size fits the number of chickens. There's no roosters allowed in Omaha. We have a new livestock ordinance that's in process that you've looked at. Basically, hopefully we'll get that approved in the next month. We did 254 animal permits in 2024, and that requires going out to each location and looking at them. We did environmental site assessments. That's whenever a developer will buy a piece of property or looking at a piece of property, you have to determine, you know, was there EPA symbols on that site, oil dumps, whatever else we have to go back through. But now we have a GIS system where everything is in one location. And like this map, this is just a whole bunch of little things that we look at for an environmental assessment, and makes it much easier than pulling paper files that we did in the past days. This is my awesome crew. Up top is our 3 air quality people. And like I say, when you look at all this, it's a huge responsibility, but then when you look at the number of employees responsible to try to take this on, it's relatively small. I have 3 air quality employees, Chrissy, Lizzie, Brian left. I have Neil, but he did not want his picture taken, so he is not in here, but shout out to Neil. And then at the bottom is our sanitation crew. We have Jared, Alan, John, Jeremy, and my great secretary, Carmelita, and our part-time X-Division chief, Doug, occasionally will come back and help us out when we're really behind. Some of you might remember Doug Clark. Do you have any questions?
Thanks for the presentation. That is a lot of responsibility and a lot of items that are important to public health. Just two follow-up questions from me. I saw on your slides you were referencing the 16th and Whitmore air quality site, monitoring site, and it showed that in terms of ozone in the last year or two, we were within acceptable EPA ranges, but I think the primary measure there is sulfur dioxide, right?
Correct.
Being close to the OPPD plant. I'm curious what you're seeing there as a trend in the last year or so.
Right. When they had 4 towers originally that were coal burning. So when I started in 2003, SO2 numbers were definitely higher. You know, we would see the occasional, when there was an inversion or something like that, we would see a spike that would be relatively close to the NACs for SO2. Now that they're down to 1, and the other 3 are natural gas burning, we see a spike maybe, you know, not very often and not very high. I'll just say that it's probably 60 to 70% lower than what we saw back in, you know, 2005 or 6 before they started working on it.
Okay.
But that doesn't mean I have to start thinking about, okay, what's natural gas and what are its pollutants that we should be looking at. So we might have to switch our thought pattern on from SO2 to something else that would be produced by natural gas.
Okay. But the SO2 levels are trending downward in a continuing fashion with,
Yes.
with the transition there?
Mm-hmm.
Okay. And within acceptable EPA standards?
Yeah, it's never been out of non-attainment there.
Yeah.
And we've even you know, we're required to put another monitor closer to OPPD, and that didn't show any numbers that were closer. 16th and Whitmore looks like the proper spot for that, our monitor to pick up anything if it comes from comes from OPPD.
Okay, thanks for that. And then also thank you for your interaction with the city code department, particularly as it applies to the mold issues and the bed bug issues you were just talking about. I know you've had some interaction with our landlord registry program and also the challenges at OHA recently, in particular with bed bugs. Do you want to describe a little bit your work or the current status of that?
So we were initially involved with the OHA. You know, we came in and did inspections on probably 5 or 6 properties that were in there on an occasion there, and did see some issues going on there and kind of responded with OHA, and Dr. Hughes has been working with OHA as well. OHA has been a little more receptive to going in and helping, you know, each person that's living there. I can't get too involved in it. There's some lawsuits now, I believe, between people that live there and OHA and stuff like that. I don't believe we're involved in that whatsoever. But we were basically kind of the initial driver, you know, to get in there and kind of see some of the issues that were going on and work with them to get the conditions improved.
Okay, so you've been serving in more of an advisory role with your expertise in that area. Is that
Yeah,
the way to describe it?
Yeah, basically, if they still call and say, hey, I have mold, we'll go in and look at it and let OHA know, hey, you know, we saw mold in that apartment, still send a letter. I think OHA has been working more personally with the complaint. If the complaint comes in, they'll work and address it, where before maybe there wasn't as much work with the client and OHA together. So I think that's improved.
Okay, thanks.
My understanding is that a recent development from the National Weather Service is that they're no longer translating into Spanish any weather alerts. Do you have any information on, like, does your department help with that at all, or can fill in the gap there?
With the Weather Service, you know, I'm not so sure. Our public response person will put it out in both English and Spanish. So coming from the health department, it'll be in both. I know I've been reading that there's some volunteers that want to help with the Weather Service, you know, to help get it out in Spanish, and I'm not sure how that's going yet. I did read, you know, there was local stations and whatever else that said we will get this out in Spanish if you can't afford it. So we'll see how that kind of rolls forward when they get those teams worked out.
Use balloons affect us any? In which
The balloons will show us directional patterns of wind flow that are higher in elevation. So it would affect us somewhat on actually being able to see the vector direction of the air quality, you know, as it's coming from Kansas. We do have some good satellite data that kind of picks up some of the wind directions, so that helps. But I believe they use the balloons quite a bit to see, you know, inversion type properties or wind directions up aloft, you know, that kind of stuff. So there will be some effect on us being able to predict the air quality patterns.
You want to keep us updated because we need to be on record on that. I want to be on record for it.
Okay.
So are you recommending a mold standard?
Yes.
What can you?
I don't know what levels that would be, but I know other states do have some mold standard. I think Colorado might have one.
Can you all put something together and also at the same time put together what authority the board has to do that, and then
Right.
let us think through it?
Yeah, I'd have to look into what other states, you know, how they enforce a mold standard. You know, I think a lot of places don't do it because, you know, some people are affected by mold. Other people, you know, could live in a house full of mold. There's highly susceptible people, you know, to any kind of mold. So I'm not sure if that's the reason they haven't established, you know, a mold standard.
Well, yeah, I mean, if you want to put it together, see what the county's powers are, but if not, the city has powers.
Right.
And you shouldn't let a good crisis go to waste. Since OHA is on people's minds, if you want it, you need
Right.
to put it together
It would-
so we can get it.
It would be nice to have some kind of enforcement. And I think if there was enforcement, city codes could, you know, actually, they don't do anything with mold.
Oh, no, you ain't got, I'm asking you to do it just
Right.
so we can make the pitch.
Yeah.
Okay.
And I think if we had a standard, city housing codes could probably
Okay.
take up some mold issues on their side, because there'd be a standard set for a code type issue.
Okay, go for it. I would, how long I would plan to do it, to try to put something on the agenda in June whenever the new council takes place, so they can come fresh out the box with it.
Okay. See
Okay.
what I can do.
The environment be a little riper since people have campaign promises they need to keep, so,
All right.
all right. I got one last question that I need you to verify for me if this is right. So this issue with rodents, I'm assuming we had a kind of a milder winter than usual. Is it my understanding it was told to me that the weather helps kind of rid some of this rodent situation in some places, that if it's, when the weather gets real hard and cold, it kind of kills off eggs and things, and when it does not, it allows them to kind of not, well, I won't say multiply, but it doesn't allow the issue to be addressed as it could, because the weather didn't kill off some things as it should, and you have probably more birth of them.
Right. I would take it as when you have warmer weather, mice would probably rather live outside.
So
But
weather's not a
as it
factor.
gets colder, they work their way, you know, indoors where it's a warmer environment. And so they try to find those gaps and try to work their way into the house. Same with if we had a lot of rain, it drives them rats out of the sewers, right? And then they look for some kind of shelter. So I would say that would be the weather type conditions. You know, a warmer winter might alleviate some mice issues because they can be able to be outside.
Okay.
That's why they always try to find their way into garages and all that kind of stuff come winter, is they're just looking for shelter to get out of the cold. And then they start to look for a food source once they're in.
Okay. Okay, I'll ask the other question. All right.
First, thank you to your team for the amazing work that you guys do. I was not aware of how small the team is to be able to accomplish all that work. You did mention in regards to the growth of our population here in Douglas County, and also mentioned that you might have to acquire several more monitors. My question is in regards to funding those monitors. Do we have a plan for that? And then would that also require to hire more staff members?
Right. So we're funded based on each monitor that we run. The environment we're in right now. So let me just say, you know, things are a little up in the air with the EPA and all that stuff. That's how we get funded. When we reach 1 million, we're required to do that, but the EPA basically has to come out and say, okay, we're ready for you, you know, to take those responsibilities on. Will that happen right away here? I don't know. But then the state of Nebraska gets the funding for it, and then they pass it through to us. So what we would do is basically put together the whole plan on building everything, how much it would cost, and then the EPA would actually pay for all the equipment, the instruments, the location, all that kind of stuff. And then after that, it would be our air quality department's responsibility to maintain it on the funding we get that's provided to us to run those instruments. Thank you.
I feel like there's a whole lot for us to cover today, but I know we don't have tons of time, so I will try to make this as succinct as possible. Okay, so I actually have a couple months of updates that I'm giving you since we were stuck home in blizzards in March. Our conference room, which you know we were working on renovating, is now fully complete. So that space is being used, and we are very excited to be able to use it a little bit more effectively. We were even able to host a FEMA meeting in that space for the case review team to come in, and I think that might have been the first time we've ever been able to do that, so that's really exciting. One of my visions for that space is that it is set up more appropriately to be able to convene partners so that we're not always having to go to our partners and ask for space when we're working with them. And so I'm very much looking forward to seeing how we can continue to do things like that. We held a contest, March Madness style, to name the conference room. We decided our new conference room needed to be given a good name. And so the winner of that, and I am not sure about the pronunciation, it's either the Pacote or the Picati conference room. And this name is after Susan LaFlèche Picati, or Pacote, who was the first Indigenous woman in the country to receive a medical degree, became a doctor, was actually here in northeast Nebraska, and was part of the Omaha tribe. And we thought that was quite fitting, given that our area that we serve is on the traditional Omaha lands. And she actually was a very, very strong supporter of sanitation and other public health measures. And so additionally, it was just a great choice, and that was totally our entire employee base got to vote for that, and that is what came out. So we're very happy to have a named conference room that hopefully honors some of the people who have gone before to set up public health and to advance public health in northeast Nebraska. A couple of personnel updates for you. Our supervisor in the STI control program left last week. We also had one of our administrative staff in the STI control program retire, and so we have a couple of positions there that we're working to fill right now. And we also were able to bring on a new communications supervisor, who I believe you all saw taking pictures, Miss Peta, and Sherman is her service dog, who is, it's like getting a person and a half into that position. So it's pretty fantastic. Sherman keeps us all in line. So we're so happy to have her, and just to have really be able to expand our communications capacity and be able to do a whole lot more in terms of social media and health promotion campaigns and things like that. So welcome, and we're so happy to have you. What's that? PETA, P-E-T-A. James Sisson, who was one of our epidemiologists, also retired. And so we were sad to say goodbye to him, but wish him very well on his retirement. Some other public health developments. Was it last week or the week before? You have to give me a little bit of grace, because the black hole that was the time warp during COVID has opened again for us in public health with everything that's going on nationally. So either last week or the week before, we had the Nebraska Public Health Conference, which was put on jointly by NALED and the Public Health Association of Nebraska, and it was a fantastic conference. They, I think, more than doubled the attendance this year from the year before, which is really fantastic, and they had a lot of great speakers that came in. We had some nationally known public health figures that actually got to come in and talk at that conference. If you know who Caitlin Jetelina is, she's better known as your local epidemiologist. She actually got to give our keynote, and so we had the pleasure of hearing from her and meeting her, and just being able to hear from this fantastic individual in the public health community, who has been such a resource for so many people. So that was a great time. Justin Frederick, our deputy director, last week received a Distinguished Alumni Award at the University of Nebraska Medical Center. He's been a student there a couple times now and is finishing up his doctorate there. And so we send our congratulations on his Distinguished Alumni Award. He took that opportunity to really plug the importance of public health, so we appreciated that too. Our budget is near completion, so I believe it is due on Friday, and we are on track to get that submitted on time. And while we had a smaller cushion, if you will, this year, so typically the county gives flat funding plus a small percentage to make up for just the normal increases that happen with cost of living and expenses and things like that. And so we had a little bit of a smaller cushion this year, but I think we are sitting just right at budget. So that's looking okay at the moment. However, there are things happening at the federal level and the state level that make us feel a little bit unsure in terms of what our budget will actually look like going forward. So on the county side, we're doing well. On the federal side, unfortunately, we don't have a whole lot of communication coming from any of our federal partners. So a couple of weeks ago, you probably saw in the news that there were a number of programs and employees at the federal level that were very suddenly laid off. So we had people from CDC, SAMHSA, FDA, EPA, kind of across the board that were unfortunately cut suddenly. We have no idea what that means in terms of our programs. So there certainly were entire programs from which we receive funding, federal funding through grants, that were kind of scrapped, and yet there's no communication about what that actually means for us from a financial perspective. So we're keeping our eye on that, doing our best to plan ahead and to see, if this thing over here doesn't work out, can it be absorbed over here, or really just trying to figure out the best way forward and make sure that we have good solid plans in place in case something does happen where we, lose funding. At that time, or a couple days, maybe a day or two earlier than that, we also received stop work orders from the CDC through the state. So there were 3 major grants of ours that were impacted by that. We got away somewhat luckily with this. So one of those, the money had already been spent, so we had already completed that grant. So obviously there was nothing to claw back in that instance, so that was good. Another pot of money was small enough that we were able to absorb that amount into another program, so we could continue that work going forward. And then the big one, which was $900,000, was an ELC grant. And really what that was meant for was to expand and boost our response capacity in terms of surveillance, epidemiology, outbreak investigations, labs. So being able to, pay to send labs off to local public health lab and things like that. That funding we had not actually signed the contract for. The blizzard actually kind of saved us in this instance, because we would have probably signed it at that time. We would have gone forth spending it right away, and then we would have had to figure out, kind of last minute what to do after we had started spending the money. So because we hadn't gotten to that point yet, we had not allocated spending into that grant, and so it was basically like we just never got that money. That money was additional to what we already have, so it wasn't something that was necessary for our current capacity per se, but it is something that would have been very helpful, especially as we have, it seems like, more frequent outbreaks of things that we haven't seen in a really long time or before, to really ensure that we have good capacity to respond. If you think back to COVID, I know none of us really like to think back to COVID, but you remember for contact tracing and things like that, we had to very quickly find a whole lot of staff to really backfill into that role so that we could keep up with the amount of work that was happening at that time. And a lot of that was, through contracts, and temporary staff that we were able to do this. That grant money would have alleviated some of that, if something would come up. But unfortunately, that funding appears at this time to be gone. Now, 23 different states, Nebraska not being one of them, did file a suit against the federal government for basically to reinstate those funds. If they do reinstate those funds, then everybody would get those funds back. So at this point, we are not planning for them. If we get them back, fantastic. If we don't, we can just continue moving forward. But again, in terms of all of the other federal grants, we just don't know right now. And what I'm hearing is that some of those programs that were cut are hopefully going to be stood back up under the AHA, which is the Administration for a Healthy America, that was recently stood up as a new agency, essentially to bring some of these services under, I guess, a different administrative structure than just the CDC. So we will see what happens. We're keeping our ears to the ground, keeping our eyes on the news, and just trying to muddle our way through that. Speaking of new and not seen for a long time sorts of issues, I'm sure that by now you have all heard about the measles outbreaks. There are multiple that are happening around the country. The numbers there are well over 700, starting to approach 800. The majority of those cases are still occurring in Texas, but however, we have seen definitely spread to a number of other states. Nebraska is not yet one of them. However, we do have a number of cases and spreading in Kansas and in Colorado. Those are right next door for us. So we wanted to assure that we are as prepared as we can possibly be when that does happen here. We're saying when, because we know that it's more than likely we will see a case or two here eventually. So I wanted to just, in response to Jeannie Weiss's question about in email, saying, hey, what are we doing in terms of measles? We stood up our internal team, so basically our internal ICS structure, a couple of months ago. So basically when we first started hearing about the outbreak, we already stood up our team to start talking about what would we need to have on board to respond, what would we need to do in order to respond. And so those conversations have been ongoing. In fact, I met with that team yesterday afternoon just to talk a little bit further about some of the details around what it might take to do different kinds of activities such as vaccinations or coordinating communication, things like that. And so I feel very confident, honestly, that if we do have a measles case or measles cases here in the metro, we are really well aligned to respond to that and to hopefully keep it contained. Our vaccination rate here in Douglas County is not as high as I would like it to be, but we are definitely higher than a lot of other places. So we're sitting between 93 and 95%. We prefer over 95% to make sure that a community has herd immunity with measles, because measles is one of the most contagious, if not the most contagious, infectious disease out there. So yeah, I would love to see those numbers a little bit higher, but we are definitely sitting in a better situation than places that are like in the 80s, 70s, or maybe even lower. So I think that we are, if it does come here, looking at if we had some cases, there likely would be a handful. But again, I feel like we are pretty well aligned, and we've been talking with our partners in the medical systems as well, just to discuss those.
Is that total vaccination rates or just vaccination rates of our youth being vaccinated?
That is vaccination rates here in Douglas County, and that is probably not a perfect number because reporting vaccinations into the vaccine registry is not mandatory in Nebraska, so we don't have exact numbers. We do usually poll our schools to find out what their overall vaccination rates are, because they do track that individually in their school systems. And so we've basically put it together from what our schools are telling us.
Mainly children being vaccinated, right?
Correct. Okay. Yep. Yeah, if you're talking like adult rate, I have no idea. We unfortunately just don't have great data on that. Okay, I think that is all I have in terms of director's report. I know we're coming up on 10, but I can do a very fast legislative update if you're up for that. Okay, so Nebraska legislature still going strong, still in session. We are still looking at potentially facing a cut in LB 261, which is the big state appropriations bill that basically appropriates funding across numerous agencies within the state. I don't know what that number is yet. It's gone back and forth a couple of times. Sometimes we hear we're going to get that full 4.5% or $4.5 million cut to public health. And just for a refresher, here in Douglas County, we get about $1.9 million through that. So most of that money comes to us to serve our residents here. Sometimes we hear that some funding is in discussions about being restored into that. Unfortunately, it's still under debate, so they are in executive session, still debating where the funds are going to go. I recognize fully that they are in a really tough situation trying to balance the state's budget right now. And so I think everybody is kind of feeling the pain a little bit. However, we're still continuing to advocate for full restoration of that $4.5 million, especially in light of not having really good, clear pictures about what's happening federally. Some of those federal funds already being clawed back. And so we will continue to advocate for that. We anticipate that a bill will go back to the governor, and there will be kind of some back and forth, maybe even all the way up to the middle of May. So we are not expecting to know tomorrow about our state funds, but we are continuing to keep our eye on that and continuing to advocate for what we need to serve our communities across Nebraska. And then just a very quick update on a couple of bills that have passed. The Nurse Home Visiting Act, which essentially requires offering a nurse-led home visiting program to Medicaid recipients, did pass the legislature, so we're very happy about that. And also, you may remember Dr. Leah Casanave talking about changing the syphilis guidelines so that we're testing pregnant women 3 times during pregnancy versus the 1. And that bill that basically requires testing of pregnant women 3 times during pregnancy for syphilis, that did pass. So we're very happy about that. And hopefully that will go a long way toward helping us prevent cases of congenital syphilis across the state. And that is all I have for you for legislative updates. I'm happy to answer any questions that you have.
Any questions? No? All right. Well, thank you for the
All right.
reports.
Thank you.
And then we also had the department reports submitted through the link. Was there any questions that anybody wants to bring up for the department reports?
Actually, mine just was more of a request. I had put in 2 requests. One, just for the board's awareness. One was just an update on the measles, and the other was an update on femur.
Yes.
Just knowing that it's been a long time since you guys had a nurse, and I know she's started. So just, I want to put that on the radar, that an update would be great. But I also want to
Absolutely.
make sure she has her feet underneath her and ready to go. And
She's done an amazing job. So we actually have a team now, which is pretty awesome and amazing. So thank you to Dr. Johnson for making sure that happened and kind of building that up. I will say, so we actually originally had it on the schedule, I think for February, and that was just a little too soon. So I do have it somewhere on the agenda, likely after our State of Public Health. So probably sometime this summer, we'll get you an update on that.
And just to give you a really quick overview, and we will put something together, but we have conducted 4 case review team meetings so far. We've reviewed 3 cases and are set to review our 4th case this coming week. And then the community action team, which is what we have historically referred to as Baby Blossoms, has convened once so far. So we're moving along. Things are going really well. There's a lot of community buy-in and interest in continuing to address this. And so we are continuing to double down on our commitment to make sure that babies can make it to their first birthday and can make it to kindergarten. So,
Awesome, thanks. All right, so with that, just the announcement of the next Board of Health meeting will be on the 21st of May. And then we have our monthly committee meetings this next Monday at 1. And is there any need for an executive session today? No? So can we get a motion to adjourn the meeting?
Second.
Second? All right. Betcherson. And Weiss?
Okay. Wade,
Yes.
McNally, King, Festerson, Jones, Rogers, Espinoza, Wilkin, Weiss.